For today's Health Watch, we are recognizing what is National Home and Hospice Care Month. HCR Home Care has been offering services to those in the Finger Lakes, all over upstate New York now for more than 45 years. Adrian Mann is the Chief Nursing Officer, Dr. Jack McIntyre, the Medical Director. Glad to have you both in here. Adrian, I will start with you. What is your main message here for this month?
So first of all, we do want to recognize and celebrate our clinicians for National Home Care and Hospice Month. And we want to recognize that it's not only clinicians such as nursing and therapy and social work, but it also includes home health aides as well.
The type of conditions people have. Some people may think that this just may be later in life, whatever it may be, but commonly we're talking about knee replacements, joint, hips,
yes.
PT. You service a lot.
Right. So we also take care of post-operative patients, as you stated, our ortho patients. That is huge amongst our patient population. Diabetes, congestive heart failure, COPD, a lot of chronic conditions as well.
How do people end up at your group?
So a lot of times they come out of the hospital, so it's a post-op procedure that they've received. They're discharged from the hospital. They'll come in and have services through us or their doctor's offices. They may have a chronic condition and their doctor recognizes that they need help as well. They also can come out of rehab facilities.
Doctor, we're getting close to Thanksgiving, holiday season. What is the issue this time of year with home care? Something comes up and maybe they neglect it.
Yeah, that's a very good point. We're delighted to be here this morning. And holidays is a difficult time for patients in a number of ways. And very often, unfortunately, we find that patients may miss sessions of their home care, whether it be nursing or physical therapy, and that can lead to a problem. If you're having wound care and then you miss several sessions or 2 or 3 in a week, that can cause an increase in the infection, lead to other problems, and sometimes even ends up having to go to the hospital or at least the emergency room to care for that. Physical therapy, missed visits end up in some decreased mobility. Folks are not as steady on their feet. They may fall. Falls are one of the big issues that we try to prevent at home. So that's another issue in terms of missed visits. One of the other things in terms of the holiday season is, generally holiday seasons are, people think of them as enjoyable, family, etc. But for many patients, that's not the case. They may be despondent in terms of a number of losses or isolation, etc. And so for them, the visits at the holiday time are especially important in terms of their relative isolation. And
listen, it takes a special type of caregiver to come in and do this. Thank you both for coming in and sharing that. You want some more resources about HCR Home Care? You can find that with this interview will be posted today at rochesterfirst.com.